good evening, everyone, and welcome to the Norton Infectious Diseases Institute's COVID Comeback Series. This is a monthly virtual program for people recovering from COVID-19. My name is Erica Coghill, spokesperson for Norton Healthcare. A few notes to mention before we get started tonight. We will have some opportunities for you to ask tonight's speaker some questions. So we do ask that you please leave those questions tonight in that Q&A box. You'll see it right down there. We'll keep those anonymous. Now, more than 540 million people have survived COVID-19. That's a staggering number. For most people, the symptoms subside and they're able to return to everyday activities with little to no side effects. But unfortunately, for others, that road to recovery can be very difficult. That's why the Norton Healthcare Infectious Diseases Institute assembled the long-term COVID Care Clinic. This clinic is overseen by a nurse practitioner, and patients can self-refer for follow-up care ranging from physical rebuilding, memory loss, migraine, or persistent headaches, and much, much more. Not everyone feels that they need to go to the doctor to help with those long-term COVID-19 related issues. So that's why we have assembled this virtual event, the COVID Comeback Series. Each month, we'll invite a specialist to share suggestions and resources to help you in your recovery. This month's program is focused on the physical rehabilitation that many have sought as they recover. Tonight's speaker is Corey Malone, Clinical Director of KORT Physical Therapy at 6 Mile. He's also the Recovery and Reconditioning Program Champion. Corey completed his undergraduate degree in Health and Human Performances in 2011 from the University of Louisville and graduated with a doctorate in physical therapy in 2013 from Bellarmine University. Corey spent 2 years practicing orthopedic physical therapy in Baltimore before moving back to his hometown of Louisville, Kentucky in 2016, where he began working at KORT. Corey completed an orthopedic residency program from KORT and was board certified in orthopedics in 2018. His clinical interests are in hands-on therapy, sports-related injuries, restoration of cardiovascular fitness, and clinical decision-making. Corey enjoys spending time with his wife and daughter, running and cycling. Thank you so much for joining us tonight, Corey. We are so excited to hear from you. Let's go ahead and get started.
Thanks, Erica. Appreciate it. So thank you to everyone who's jumped on here, spent time out of their day to listen to me talk about this. I'm hoping that everyone gets something out of this that you can learn and take home and utilize to help get yourself better and maybe even educate your friends and family on this if they're suffering from deconditioning. So I'm going to go ahead and share my screen here. Okay, so I was asked to come here today to discuss with you all recovery, exercise, and reconditioning. Now, many of you may have suffered from COVID-19 or known someone that had suffered from COVID-19 in the past, and many of you may be suffering from symptoms of long COVID, which is typically any symptoms you may still feel or experience after having COVID-19 for upwards for 2 months after you've recovered from COVID-19. And many of you may not have actually had COVID-19. Many of you may be coming on here just to learn how to recondition after some form of deconditioning. And we're going to go over all of that today and how you all can get stronger, in better shape, and get back to your prior level of function. So let's get into it. So again, like Erica said, my name's Corey Malone. I have my doctorate of physical therapy. I've been a physical therapist for 8 years now. I went to U of L for my undergrad, where I got my bachelor's degree in health and human performance. I'm residency trained in orthopedics. I have a strong interest in the cardiovascular system. And I currently work at KORT Physical Therapy, where I direct a clinic, and I also run the recovery and reconditioning program for KORT and Select Medical. So today's objectives, what I hope you all pull from this today, I hope you all just understand the basic definition and what the cause is of deconditioning. I hope that you all will help understand the role that exercise has in combating deconditioning, recognize different modes and types of exercises that are appropriate while recovering from deconditioning, and identify appropriate starting exercise parameters and appropriate progression of exercise while recovering from deconditioning. You're going to notice I'm going to say deconditioning a lot versus long COVID, because again, not everyone that's on here today may be suffering from long COVID. While this is what really started this recovery series, many of you may just be suffering from just general deconditioning for other reasons. So what is deconditioning? Well, deconditioning, the actual definition of it is this. It's a complex process of physiological change following a period of inactivity, bed rest, or sedentary lifestyle. And ultimately, it results in functional losses in areas such as your mental status, degree of continence, and ability to accomplish activities of daily living. So it's a very broad term. Again, it doesn't just have to be COVID-19 that causes deconditioning. There can be many other causes. What exactly occurs during deconditioning? Well, a loss of muscle mass is very common during deconditioning. This patient in this picture is actually someone who suffered from COVID-19. I believe this picture actually circulated the internet quite a bit when COVID first started, just to demonstrate the ill effects of COVID-19. But this is a perfect example of what muscle atrophy looks like, or the loss of muscle mass. And so what we found is that the disuse of muscles, so just being bedridden or not using those muscles for a period of time, you can lose up to 12% of your muscle mass a week. And if you do the math, it's kind of crazy. You can actually lose in the matter of just 3 to 5 weeks of not using a muscle. You can lose almost up to half of your normal strength. So that to me is pretty significant. That's incredible, because it does not take that long to get weak. We all know that it can take a really long time to get strong, but our bodies really quickly start to decrease our muscle mass in order to conserve energy. Other things during deconditioning are things such as muscle contractures. A muscle contracture is where the muscles shorten and you aren't as flexible as you once were. And that can develop in as little as 4 days of not moving a certain body part. And it can take months to even years to reverse that. So it's pretty significant. If you're not able to move your body the way that it's supposed to move, you can start to develop really other issues, such as problems with walking or getting in and out of bed or a car. And it can start to lead to problems like pain and balance issues. Other things that can happen during deconditioning are things like changes in your joint and bone structure. And so what I mean by that is you can actually develop things such as osteoporosis and arthritis when you're not moving your joints. Our joints are meant to move. Our joints like movement, and they actually produce a lubricating fluid called synovial fluid when we put pressure through our joints and we move around. So when you're not doing that, you can imagine, like in a car, where if you're not driving your car doesn't circulate the oil throughout the engine and all the moving parts, and it can start to get rusty. The same kind of thing can happen to your joints. So ultimately, how can deconditioning impact you? Well, you may experience things such as decreased energy, joint pain and stiffness, and decreased mobility. So when you become deconditioned, you become weak and you become stiff, and simple movements can be really labored and painful. So when it takes more effort to move your body, it can drain you of your energy levels. So this can become, you can imagine, a vicious cycle where you lose motivation to move because it hurts and it's difficult. And then you start to suffer from more muscle atrophy or muscle loss and joint stiffness. And your overall mobility begins to suffer, and you may end up requiring something like a walker or a cane to help you walk. All these are not optimal. So you might be asking, well, what causes deconditioning? And I've already touched on this a few times, but typically things such as prolonged bed rest or hospitalization. And so things that you can imagine that might cause this are things such as after some sort of injury. Maybe you broke a bone and can't get out of bed, or you're not allowed to put pressure through your foot for a long period of time. And so those muscles in that ankle start to atrophy. Maybe you're ill, maybe because of COVID-19, or even just the flu or any other sort of disease. And that can take you out of it and put you in bed for a long period of time. Remember, it doesn't take long to start to atrophy in your muscles. Maybe after surgery, maybe you had a planned surgery and unplanned surgery, and You're required to not do any activities for some period of time. Those are all reasons for deconditioning. Another thing that unfortunately a lot of us suffer from is a sedentary lifestyle. So things such as having a desk job, that's something out of your control, right? We have to go to work, we have to do the job duties we have. And unfortunately, we don't necessarily get to choose if we have a desk job or not. And that's just the reality for a lot of people. So, but having a desk job can lead to deconditioning. Unfortunately, mental health issues, which are quite prevalent in our society, those are things that can lead to deconditioning or a sedentary lifestyle. If you don't have the mental capacity to do things throughout your day, you don't want to move. And then things such as comorbidity. So maybe you have heart conditions or lung conditions or what have you. These are all things that can lead to you becoming deconditioned just because you're not using your body. So how can you fix it? That's really, in a nutshell, that's why you're here today, and that's why I'm talking to you. So how can you fix deconditioning? Well, there's no pill for it, unfortunately. There is no pill to fix deconditioning. So exercise is going to be one of your best friends. So if you're someone that's suffering from deconditioning and you're trying to get in better shape, but you don't know where to go or what direction to go in, you can start with physical therapy. That's the role of a physical therapist. We are movement specialists. And so we love to help people get back to doing things such as their prior level activity. Also, you can do independent exercises. If you have a background in exercise, you may know all the reps and sets and the parameters of exercise that you need to do. And so you can do all these things on your own also. And that's ultimately the job of a physical therapist, is to teach you how to do these things on your own. Nutrition is a big factor in reconditioning. A lot of times people's diets are not the best. And so people eat a lot of fatty or sugary foods. And if you can focus on really high quality protein diet, drinking lots of water, those types of things, they help at the very least, they slow down the deconditioning process. And at the very most, if you're doing exercise, it can really help you in your reconditioning. And then also mental health services. So we talked already in the last slide about how mental health can lead to a sedentary lifestyle. Well, if you're suffering from some mental health disorder, it is very important to reach out to someone like a psychiatrist or a psychologist or even a spiritual health professional. And I believe that there's going to be another comeback series specifically on that. So I won't get into that today, but those are things that are important to take into consideration when reconditioning. So how long does it take to improve? Well, typically someone that's suffering from any sort of musculoskeletal disorder, it can take anywhere from 6 to 8 weeks to start to see improvements in the musculoskeletal system. Now, you may start to see improvements even sooner than that. We see a lot of people start to report improvements in overall energy levels and even feeling stronger after only 2 weeks of doing exercise or doing physical therapy. But each system is different. So if you look at these pictures here on this slide, you'll see that for aerobic exercise and strengthening exercises, there's different processes that happen in order to get someone stronger or more aerobically fit. So when it comes to the aerobic system, you start doing aerobic exercises. It takes about 6 to 8 weeks to start to see changes in terms of the number of blood vessels in a muscle, or the number of mitochondria, which are these little cells in your muscles that help produce energy. And then in muscles, in terms of strengthening, it can take 6 to 8 weeks, simply because when you do an exercise, the goal is to actually break that muscle down. And then you need to rest, and then you need to eat properly. That nutrition plays a big role. And then with that, your muscles come back and grow to be even stronger. And to really start to see significant improvements in that, it takes about 6 to 8 weeks. And so this includes anyone for any type of deconditioning, whether it be you suffered from COVID-19 or for some other reason you became deconditioned. It's typically that. Now, I will say that people suffering from COVID-19, unfortunately, have a lot of other comorbidities, and they may also have a lot of other systems that are being impacted because of the effect that COVID-19 has on our bodies. And so because of that, it can take longer for people for other reasons as well, but especially for COVID-19, to get better. So in this slide here, this is a article that was produced out of China where they looked at 856 patients, and they found that 252 of those patients had comorbidities who were suffering from COVID-19. And what this article found was that the more comorbidities that someone had, the more severe symptoms they may have. So you can imagine that if you're suffering from COVID-19 and you have a lot of comorbidities, and comorbidities include things such as obesity, heart conditions, lung conditions, high blood pressure, what have you. So, and a lot of people are suffering from those things. So what you can see is that a lot of people who suffered from COVID-19 had more severe symptoms simply because of the comorbidities. So you can imagine it may take those people longer to recover from that deconditioning that they experienced due to COVID. Just to talk about the overall time it takes also, and the prevalence of long COVID in patients suffering from COVID-19. I wanted to include a couple of articles here. This is from a journal called the Lancet, which is a very well-renowned journal. And this found that 6 months after COVID-19, people were still suffering from some long COVID symptoms. So primarily fatigue and muscle weakness, but also things like heart palpitations, joint pain, dizziness, and headaches. So you can see that's well beyond the 6 to 8 week marker that we typically like to see people for something like just general deconditioning. Lancet then did a follow-up study, and unfortunately what they found was while people did typically start to improve, they still found that a year out from having long COVID, or a year out from having COVID-19, they found that still 49%, or almost half of these people, still had one residual long COVID symptom. So again, depending on what you're suffering from, the number of comorbidities you have, the reason for your deconditioning, it can take longer than just 6 to 8 weeks to get better. So you're suffering from deconditioning and you want to try to get better. Well, how do you get started? Well, really, it just kind of depends on what your insurance is and what your comfort level with exercise is. So if you're really comfortable with exercise already, just get to a gym and start working out. But if you really want some direction and some guidance in regards to how to safely get back to exercise after suffering from deconditioning or suffering from COVID-19, it really just depends on your insurance. So if you have a federally funded plan, such as like Medicare or Medicaid, you're going to want to see your primary care doctor first. And so that way they can write a referral for physical therapy. However, if you have a non-federally funded plan, so such as like Anthem or Humana or what have you, it's a direct access state in Kentucky. And so you can actually just call a physical therapy clinic, and I'm biased, so you can call KORT Physical Therapy, and you can ask to go ahead and start seeing a physical therapist. And specifically, and I'm going to talk to you for a second about this, KORT's Recovery and Reconditioning program is an excellent program that helps patients recover from deconditioning after things such as COVID-19 injury or illness. So the Recovery and Reconditioning program, or we call it the R2 program for short, is a excellent option for people suffering from deconditioning for any number of reasons. And it was launched back in June of 2020, so kind of right when the pandemic started. And it was developed in partnership with leading physicians, people including psychiatrists, pulmonologists, cardiologists, infectious disease experts, as well as physical therapists, occupational therapists, and speech language pathologists. And we followed evidence-informed program guidelines, and our licensed physical therapists, occupational therapists, they tailored a plan of care to address patient-specific needs and goals to resume pre-COVID activities and routine. Just as an example for how long it may take to begin to recover from deconditioning, patients who participated in our R2 program, they average around 15 visits over the course of about 60 days, so 2 months. And the majority of these patients are long COVID patients. So it's really not a fair indicator for how long it's going to take for just anyone with deconditioning to recover. But this does give you an idea if you have COVID-19, about 15 visits over a 60-day period. And that being said, what we found through the R2 program was to date, about 75% of these people show improvements 58% of those showing, 75% showed physical improvements, while 58% even showed mental improvements by participating in the R2 program. And this program has seen over 4,000 patients nationwide so far. So we have quite a large population size of people to pull data from for this. There we go. So now I want to talk to you all a little bit about what the goals of the recovery and reconditioning process are, specifically the recovery and reconditioning program. So first off, let's talk about endurance. We absolutely want to improve people's endurance after deconditioning. This is one of the big things that people suffer from during deconditioning. And so what we see is these patients lose a significant amount of endurance due to long hospital stays, their admission to intensive care units, and because of the development of post-intensive care syndrome, should they go to the ICU. Also, because of the potential damage to the lungs because of COVID-19, these patients experience a significant amount of things like shortness of breath, and a lot of times we'll see their oxygen levels drop during exercise. And so this poor regulation of oxygen leads to things such as muscle fatigue, labored breathing, poor metabolic efficiency, which kind of creates a vicious cycle of further weakness and fatigue, like we talked about before. It's our job as a physical therapist to intervene before those things get too bad and stop that deconditioning process and educate patients on things such as how to monitor their vital signs, how to monitor their oxygen levels, educate on more efficient breathing techniques, and just to improve the overall efficiency of the cardiovascular system. Another goal of the R2 program and just reconditioning in general is to improve the musculoskeletal system. So again, a lot of people atrophy after COVID-19 or deconditioning. And so should a patient have suffered from an infection, they could have even lost more muscle mass, because what happens is your body goes into survival and its goal is to try to conserve as much energy as possible. Your muscles use a lot of energy. So if you're not getting out of bed, your body starts to break down those muscles for energy to help fight off that virus. So what physical therapy will do, it will assess a patient's overall strength after suffering from deconditioning, and will help provide really individualized exercises to help address a patient's weaknesses after suffering from deconditioning. Another thing we want to focus on after deconditioning in the R2 program is improving a patient's safety and their safety awareness. So patients recovering from deconditioning, oftentimes they have cognitive dysfunction or difficulties with processing information. And this can lead to things such as balance deficits and injuries. So deficits in safety awareness, they can be due to any number of reasons. So COVID-19 can have a direct impact on the neurological system. Other reasons include things such as poor oxygenation to the brain, so you don't think as quickly as you should, side effects of post-intensive care syndrome, and sleep deprivation and stress. So that's another big thing. Getting good sleep and regulating your stress levels outside of exercise are all very important things in terms of overall health. So things to keep in mind. So things we check for in physical therapy, we screen people for fall risks after deconditioning. We educate patients on safe home environments, so making sure there's no rugs around the house that they could trip on, or making sure they have someone at home to help keep them safe, and just making sure they have an overall healthy social support system available. We also help educate these people on vital signs, because what we find with COVID-19 is a lot of patients suffer from adverse vital signs responses during exercise. So maybe their heart rate goes too high, or their blood pressure spikes during exercise, or their oxygen levels drop. Well, we want to know what are safe vital signs to use during exercise, and this is something we'll educate people on. And I'll even educate you all on this today later in this presentation. Again, this kind of plays hand in hand with safety awareness, but we want to just overall improve normalized functional mobility. So many patients recovering from deconditioning will present with significant mobility deficits, secondary to weakness, joint stiffness, pain, and balance deficits. And so physical therapy is a perfect intervention for this to address the mobility deficits, and it plays an integral role in terms of getting these people back to their premorbid status. And finally, one of the goals of the R2 program and physical therapy in general is to just screen for other possible problems with these people. So again, like I said, COVID-19, it has a huge impact on a lot of different systems. Physical therapy is not designed to help every single one of those systems. But what we are trying to do in physical therapy, and specifically in the R2 program, is to screen patients for these other possible problems that could cause adverse reactions during physical therapy and during exercise in general. And it helps us guide patients to the right specialist to make sure that they're getting the care that they need, such as the long-term COVID care clinic. Okay, so now kind of for the bread and butter, this is hopefully what a lot of people came here for, was to try to figure out how do I safely exercise and recondition after I've suffered from something like COVID-19. You understand the goals of therapy and how we assess for deficits in this patient population. But it's important to understand how to safely exercise. So what we use here is the American College of Sports Medicine guidelines and for deconditioned individuals. And this is what helps guide our parameters. Now, I've added some slides to this presentation today as resources for you all to use, because this is a lot of information and it's going to be easy to forget a lot of this stuff. So this is one of the pamphlets that I give to all of my patients in the R2 program. And this is just red and yellow flags and precautions for vital signs during exercise. So take a close look at this. I won't go into the details just because of time today. But what it does show is things such as, what should your heart rate look like before you even exercise? What should your blood pressure look like before you even exercise? Your oxygen levels, how out of breath should you get up to if you are exercising? And then what are some common signs and symptoms that you want to look out for while you're exercising that could suggest there may be a problem going on? That's what this form is for. I'll leave my contact information at the end of the session. So if anyone has any specific questions about this form, please reach out to me. This other form, again, that Deanna should be able to make this available to everyone who's on the presentation today. This is called the modified board dyspnea scale. What this really is it's just a way for you to help measure how out of breath you feel during an exercise. And what I suggest for everyone who's suffering from deconditioning is that you set your exercise cutoff for if you start to feel like you're at a 5 out of 10 out of breath. So 4 and under is fine. Anything above 4, we want to stop that exercise regardless of what your vital signs look like. Okay, so let's talk about exercise parameters. So we'll start off with flexibility exercises. Again, you can develop contractures when you're not moving around, which is muscle tightness. So per the American College of Sports Medicine guidelines, a patient should perform a stretch up to a total of 60 seconds per joint, and they should hold each interval for around 10 to 30 seconds per interval. So that means you may want to do a stretch for 3 sets of 20 seconds, right? An older adult can actually benefit from holding a stretch for even longer. So they may want to stretch for upwards of 60-second intervals. And you can do, say, 3 sets of 60-second intervals. So if you're an older individual, that might benefit you more than these shorter intervals. Exercise parameters for resistance exercise. It's fairly simple. So the American College of Sports Medicine suggests that older or deconditioned individuals perform 1 or more sets of 10 to 15 reps of an exercise at a light intensity level. So a light intensity level is about 40 to 50% of your 1 rep max. So your 1 rep max is essentially the amount of weight that you think you're capable of lifting just 1 time. So you would not be able to lift it twice. You can use proper form and lift that 1 time. So let's just, for simplicity's sake, say the most amount of weight you could lift, you think, from shoulder to overhead is 10 pounds. Well, according to these guidelines, you should only be working out with a 5-pound weight at most. So, and you would want to use that 5-pound weight and lift it overhead, at least for 1 set of 10 to 15 repetitions. Just for everyone to know, I will have a summary of this, and that will be able to be accessed as well. So you don't have to try to memorize all this stuff. Now, you're going to want to progress these resistance exercises as you start to get stronger. And so the recommendation for this is a gradual progression of increased resistance or increase the repetitions. So instead of just doing 10 to 15 reps, you may want to do 15 to 20 reps. You're allowed to go up to about 70% of that 1 rep max. So again, if 10 pounds is the most amount of weight you could lift, about 7 pounds is all you want to lift for if you're a beginner. If you're more experienced at lifting, you can get up to 80%, so 8 pounds. Exercise parameters for aerobic exercise. So this is a big one. And so the exercise guidelines suggest light to moderate intensity activity, or that's where you're able to get your heart rate up to about 30 to 59% of your heart rate reserve. I have actually tried to, I'm going to share something else with you all real fast, just so that you all can see what that looks like. Okay, hopefully y'all can see, hopefully you'll be able to see this in just a second. And what this is a simple calculator that I've tried to make available to everyone through email. All you have to do is put in whatever your age is and then whatever your heart rate is at rest. And so you'll want to check that, and I'll show you later how to check that with a heart rate monitor or by checking it manually through your pulse. And so what it will do is it'll calculate, if you're deconditioned, what your heart rate should be while you're exercising. So that way you don't even have to do math. So according to that last slide, or according to this calculator, I would want to keep my heart rate between 97 to 134 beats per minute. So according to this, that's exactly what the American College of Sports Medicine recommends, is that 30 to 59% of your heart rate reserve. Again, that's kind of confusing for people that aren't familiar with exercise. So if you want to reach out to me later, by all means, please reach out. Another suggestion is what's called interval training. And so that's where a lot of people can't even tolerate like even 2, 3, 4 minutes of exercise at a time. So you may want to try and start with only 30 seconds of exercise, rest for about a minute, and then do it again. That's an interval. And so it's really simple. You just try to do what you think you can tolerate, give yourself rest breaks, and do it again. And again, you'll want to progress that as well eventually. So according to the American College of Sports Medicine, you'll want to increase the duration of exercise by about 5 to 10 minutes per week until you can tolerate up to 20 to 30 minutes of aerobic exercise straight through. And then once you can get to that 20 to 30 minutes of straight through aerobic exercise, you'll want to increase gradually your intensity of the exercise by about 10% each week. So what that means is if you're on a stationary bike, a lot of times those bikes will tell you how many watts you're putting out during your workout. Say you're at 50 watts, right? The next week, if you're ready to increase your intensity, you may want to bump it up to 55 watts. You don't want to go more than that though, because you will start to feel some ill effects of overexertion. So this is that summary of these parameters that I talked to you all about. So again, we won't go over this because we just did over all those slides, but this is a nice little resource for you all to use should you be questioning what the parameters were that we talked about today. Okay, so modes of exercise. I say you have no idea what you should be doing when it comes to exercise. This guy clearly doesn't know what he's doing. Now that you have a basic understanding, hopefully, of the safe and effective exercise parameters after being deconditioned, I want to go over what are some typical and safe exercises to do. So if you're going to go to a physical therapist, we're going to check for your overall joint mobility. And so one of the exercises we can do for that is called manual therapy. Manual therapy is where we're just going to put our hands on you. We're going to stretch you out. We're going to try to make those joints move better so that you feel better and you can move through a greater range of motion to maximize these exercises. You can also do self stretches. And so I'm going to show you a couple of those today, some stretches that will help common tightnesses in people who are suffering from deconditioning. You'll also be expected, if you came to physical therapy, to likely work on some resistance exercises. Because
you're
again,
on presenter view.
Oh, thanks. I appreciate it. Let me fix that real fast. Here we go. That should be better. We'll also want to do resistance exercises. So this could be anything. It could be anything between your body weight, and you can also do weights. So your body weight alone is enough weight oftentimes to get stronger. However, if you get to a point where your body weight doesn't feel like it's working you hard enough when you're doing 10 to 15 reps of it, you may want to start to add things like dumbbells or kettlebells or some type of weight. And again, a physical therapist will help show you what those things look like and how it should feel when you're doing those exercises. There's things like resistance bands, which are very inexpensive exercise equipment that you can use at home, and they'll use those in physical therapy as well. Or you can just use things around your house. So this guy here is lifting a box. Sometimes that's all we have money for, or the only thing we have space for in our house. And so that's another good option. And as far as different types of aerobic exercise, typically what we recommend is starting in a sitting position and slowly progressing to standing. If you're standing, you're going to use more energy than you would if you were sitting. So naturally, we want to try to work on sitting exercises first and slowly work our way up to standing. So say you want to start at a recumbent bike, move yourself to an elliptical, and then get on a treadmill eventually. If you're doing the upper body, trying to do aerobic exercises like on an arm bike, you can do it sitting first and then move that to a standing arm bike. Like I said before, you can do things like lifting a box or doing work-specific tasks. If you're trying to get stronger for a work-specific movement pattern, you can just replicate that pattern itself, just use lighter resistance than you would normally. So say you're a worker at UPS or your job involves a lot of lifting, use lighter weights of that same movement pattern, do it 15 to 25 times, and that should be enough to start to condition your body to get stronger. Okay, so I wanted to give you all just a few resources on some of the recommended equipment that we'll use these things in physical therapy, especially in the R2 program, but these are things that you can access outside of that as well if you're willing to invest some money into it. So ultimately, I look at it as an investment. If you can do this stuff at home, you may be saving yourself a copay or what have you, or a gym membership. But again, you're going to want to know how to use it. And that's where you may want to go see a physical therapist first to help you understand how to use this equipment. The first thing I'm showing you all is a heart rate monitor. This is a chest heart rate monitor. This is one that we recommend our clinicians use. I promise I don't get any kickbacks for any of this equipment. These are all just things I've used in the past and they've worked really well for me. This is a Polar H9 heart rate sensor. I left the link on here so you can find it yourself if you wanted to. The nice thing about this is the heart rate monitor syncs up to your phone on a free app. And so you don't have to buy anything else other than the heart rate monitor itself. You can access the data on your phone and it should help guide you when you're exercising. If you don't want to buy a chest heart rate strap monitor, you can use one on your wrist. They're not as accurate as the ones on your chest, but they do something that's better than nothing. Or you can also check it manually by using your fingers and checking your pulse on your wrist. I will be honest, it gets kind of frustrating and annoying trying to manually check your heart rate while you're exercising. So I personally feel like it's worth the investment to buy some sort of heart rate monitor. This here is what we call a pulse oximeter. So if your physician ever tells you that your oxygen levels tend to drop when you're doing activity, or maybe you're suffering from something like COPD, this is a common thing that people will use to help track their oxygen levels. What can happen is if your oxygen levels drop too much when exercising, it can start to lead to problems. And so we want to prevent that from happening. So what we typically recommend is we keep people's oxygen levels above 90% while they're exercising. And this is a good thing to use. So you stick this heart rate monitor on your finger and it spits out the numbers there and helps keep you safe while you're exercising. Again, you can follow this link here. This one was $17 on Amazon. The other thing that you may want to get, I strongly recommend it, is getting a blood pressure cuff monitor. This one here is a really good one we use in my clinic. It's $39 on Amazon, and it tends to fit and work on most people. Again, those vital sign guidelines I gave you will tell you what your blood pressure should be before and during exercise to keep you safe. So I think we have a few minutes left, and I'd like to just go over some basic exercises that may be beneficial for you all. So what I'm going to do here is, let me real quickly pull this up. I'm going to stop sharing for a moment. And if you all want access to these exercises that I'm going to show you all, then again, reach out to me and I can try to share these with you. Okay, let's see here. Just so you all know, this is through a program called MedBridge. This is what we use at KORT Physical Therapy to help with home exercise programs for patients. So the first exercise here is called diaphragmatic breathing. What you can see here.
Begin lying on your back.
Sorry, I don't know if this is playing sound or not right now.
It is on our end. We just heard begin lying on your back.
Okay, fantastic.
Great.
I'll take the sound off, and that way I think that might be better actually, and I'll just talk you through it. So this person here is doing what's called diaphragmatic breathing. A lot of people after COVID-19 or deconditioning, they don't breathe properly. They breathe through their chest and not their stomachs. So this person here, you can see they're taking deep breaths through their stomach. They're not using their chest at all. And this is going to help optimize their breathing form so that they use less energy while breathing. And it actually helps to work their abdominal muscles as well, which tend to be lacking after a long period of inactivity. This next exercise here that we use very commonly in physical therapy is
Begin lying on your side with your.
So a clamshell essentially works your hip muscles to try to keep them strong, because again, your hips get very weak when you're deconditioned, and weak hips can lead to fall risks. This other exercise is very easy to
Begin sitting.
This is called a sit to stand. So this is going to work your gluteal muscles and your quad muscles. And so basically all your lower extremity muscles to help with overall strength and prevent your falls. This here is a shoulder exercise. You can add weights to this if you want to. And essentially this gentleman is just going to lift his arms straight up in the air, keeping his thumbs pointed straight up. And this is going to work those shoulder muscles, because a lot of times when you're deconditioned, you're not raising your arms overhead and those muscles get very deconditioned. If you're able to get on your stomach and you're able to get on on your bed, you can do what's called a prone T, where this person's going to lift their arm up in the air and work these trapezius muscles in their back. These tend to get really weak when we're sitting for long periods of time, especially in front of a computer. There's a couple of stretches here where this one's called a doorway stretch. This stretches the front of your pectoral muscles. And so a lot of times when you're sitting in kind of this forward position for long periods of time, these muscles get tight. So we want to open those up, and this will help with breathing as well. Another exercise you can do is called a kneeling hip flexor stretch, where you get in a doorway and you lean forward into it to stretch your hip muscles in the front. When you're sitting for long periods, these muscles get very, very stiff, and it can lead to problems with walking, and again, can cause balance problems. So for the most part, so overall deconditioning can happen to anyone for a number of reasons. It can impact your overall function, safety, and quality of life. Reconditioning is possible, so you are not doomed if you're deconditioned. And there's plenty of guidance out there for reconditioning. So I strongly urge you, if you're suffering from deconditioning, to reach out to KORT Physical Therapy, look into the Recovery and Reconditioning program. We have over 60 locations throughout Kentucky and Indiana. Every physical therapist throughout KORT is trained in the R2 program and would love to help you in your journey in becoming reconditioned. So this is my contact information right here. So again, if you want to call my clinic, email me, schedule an appointment, I'm more than happy to. And at this point, I will go ahead and look at some of the questions. It looks like someone posted on here already where to send those exercises to. So I will email those exercises here after we're done with this conversation right now. If whoever's email this is, just email me directly and I will email you those exercises. So are there any other questions or anything?
We do have some additional questions. Thank you so much, Corey. We appreciate your time this evening and all of the great information, a lot of wonderful information that you've shared with us this evening.
Absolutely.
Our first question is this program just for COVID patients?
No, great question. So this program was originally developed for COVID patients. However, we realized that we created the protocol to be specific for anyone who's suffering from any type of deconditioning for any type of reason. So no, COVID-19, it's not specific just to COVID-19.
Our next question, if I'm having shortness of breath or easily fatigued, can R2 help me?
Yes, absolutely. So again, we don't know to what degree all the time. So not everyone gets as great as they want to be, especially if suffering from COVID-19, because unfortunately, depending on the severity and the number of systems that are impacted, there may need to be more of a multidisciplinary approach where there's more than just a physical therapist involved in getting better. But the R2 program is designed in order to help improve fatigue and shortness of breath and muscle weakness.
Our third question, what does treatment look like in the clinic and how soon are you seeing people get better?
So it depends again on the severity. So a lot of times we'll see people in here for upwards to 15 sessions over a 2-month period. So that tends to be about twice a week for 8 weeks, if you want to look at it that way. The typical session, so if someone comes in here and they're just kind of out of breath, they're able to walk a decent distance over, say, like 6 minutes or so. They're able to get up and down out of a chair. A typical session for that person may look a lot more aggressive than for the person who comes in here on oxygen, who needs supplemental oxygen to even just walk from their car to the clinic. They might not be able to stand up out of a chair. It may be where they have to take frequent rest breaks when walking for longer periods of time. So exercise is going to look a lot different. So the first person who maybe not be as deconditioned, we're going to start off with exercises probably that first day. We're going to do a little bit of education, teach them what's safe, and then we're going to go ahead and jump into the exercises that are going to address their specific needs. So for whatever weaknesses they have, we're going to address those. But the person who walks in here the first day, who's really, really severely deconditioned, a lot of times there's a lot of anxiety with those people. Those people are scared. They've been avoiding the exercise because they're scared it's going to hurt them. And we totally recognize that. So the first day may be a lot more education and just teaching you what's safe, what's not safe, reviewing your concerns and recognizing those concerns. And then the second day may involve really light activities, maybe laying flat on your back or sitting down in a chair and doing these exercises that way with no resistance at all, maybe just reteaching you how to move your body. And then as you get more comfortable with that and stronger, then we start to get into those higher level activities. But it's only at your comfort level. And again, these are all skilled clinicians who have been to school specifically to recognize what's safe and what's not safe. And so our number one goal is safety and keeping you safe. And so that's ultimately how we're going to design the program for you.
Next person asks, I just finished cardiac rehab, but I feel like I need more PT. Will R2 help? And is it covered under my insurance?
That's an amazing question. So that is actually how we first originally started a program here a long time ago. And so, yes, unfortunately, people who go through cardiac rehab, they're limited because of their insurance sessions. And again, the main goal of cardiac rehab is to improve your heart health. It's not necessarily to improve your function. So we recognize that, and we welcome people who have finished their cardiac rehab program to come in here to physical therapy because, hey, you finished cardiac rehab, your heart is stronger, you're healthier now. You're probably now more than ever ready to take on that challenge of physical therapy. And we can help get you even stronger and we'll focus on those things that you're really struggling with. So maybe you're struggling with going up and down stairs. They don't always necessarily work with you on those things in cardiac rehab. Usually you're on a treadmill or a bike or something like that, but you're not really necessarily working on functional tasks. That's what we're going to focus on in the recovery and reconditioning program.
Next question, how soon can I start PT if I've been diagnosed with COVID-19?
So great question. The current CDC guidelines suggest quarantining after your initial onset of symptoms for at least 10 days. Now, should you still be exhibiting some symptoms and whatnot, that is very common. I would suggest reaching out to your physician if you have any concerns or anything. But if you're allowed to stop quarantining, you're allowed to start physical therapy. So I strongly urge people, as soon as you're allowed to stop quarantining, call KORT, and we'll get you into a clinic as soon as we can. If the clinician at that point has any concerns, then we'll talk to you about it. And then we'll reach out to your physician as well and just discuss those concerns with them if we think there needs to be more of a waiting period. Now, I will say if you have been discharged from the hospital because of COVID-19, I believe it's a longer waiting period. Don't quote me on this. I don't have it in front of me, but I believe it's about 14 days. But again, I'll have to look into that. So typically once your quarantine period is done, you're allowed to start.
Good information. Thank you so much. Next questioner reads or says, if I'm not feeling up to coming into the clinic and I don't have the capability to do a tele-rehab visit, is it possible for an R2 therapist to come into my home?
Yes, we have KORT physical therapists are allowed to, we have what's called our outreach program, and they are also trained to assess vital signs and perform the R2 program. And so they'll be able to come out to your house at your convenience.
Awesome. Do I need a physician referral to be a part of this program?
Not always. So depending on what your insurance is. So if you're Medicare, Medicaid, some sort of federally funded plan, then yes, you will need a doctor's order. But otherwise, no. Kentucky's a direct access state, so you can come straight to a clinic. We suggest calling before you just show up, but call the clinic that you want to go to, and then we'll get you scheduled. And typically, we can get people in within about 24 to 48 hours. So if you can't get in within 24 to 48 hours to the closest location to you, we can definitely arrange the schedule and get you into one that might not be as close and transition you over to the closer clinic if need be.
Next question reads, I live in Lexington, Kentucky. Are there R2 therapists at the KORT clinics there?
Yes.
Great. Next question, how do I schedule an appointment or find out if my insurance will cover this?
Sure. So we will, hopefully someone can post in here. I don't have the centralized scheduling number directly off the top of my head for some reason, but I can find that for you guys. You can also call my number. My clinic phone number is right here. And if you want to call that number, I'll direct you to whatever clinic you want to try to get to. So that's going to be usually the easiest way. Again, it may be worth just reaching out to me first, and I can discuss things with you on the phone as well before you sign up for an appointment.
And we have one more question. I have high blood pressure and I'm scared PT might increase it. Can PTs check my vitals, and is PT safe for me?
Yeah. So we're going to check your vital signs before, during, and after every session just to keep you safe. And if you don't fit within those vital sign guidelines, then we're going to hold from therapy. And if it's really bad, we're going to direct you to where you need to go next, whether it be go to your primary care doctor and get on the right medications, or unfortunately, some people come in here and it's too high and it's dangerous to the point they didn't even realize it, and we'll have to send them to the hospital. And I promise you, most of the time, those patients are very grateful for that, just simply because we might have saved them from something far worse. So.
Absolutely. Well, thank you so much, Corey. Those are all the questions that we have. Thank you to those of you who joined us this evening. We really appreciate your time. Norton Healthcare opened its long-term COVID-19 care clinic in September 2020. There are 2 locations, Norton Brownsboro Hospital, and then the other location is located at, and I lost my script here, so give me just a moment. So that first location is at Norton Brownsboro Hospital Plaza 1, and the Norton Healthcare Pavilion located downtown is that second location. If you need to be evaluated in the clinic, we suggest having a positive COVID PCR test or antibody test. A subjective diagnosis is acceptable prior to common testing availability. Providers see patients who are experiencing symptoms at least 8 weeks after acute infection. We also recommend being evaluated by a primary care provider prior to coming to the clinic, because many issues can be managed in that primary care setting. For the next installment of our COVID comeback series, we do hope that you will join us. We're taking December off, but we do look forward to seeing all of you in January. So be sure to mark your calendars for that particular event. The date is January 13th. The virtual event will get underway at 5:30 in the evening. To register for that event, visit nortonhealthcare.com and just search the keyword COVID comeback. That is all the time we have tonight. Thank you so much again for joining us, and we do hope to see you in the new year.